All right, so let me handle a question that I get asked all the time about how to find a cosmetic dentist. So this one came to me because I was talking to some family members or people that I know that live in different places around the country. They're not going to fly all the way here to get their cosmetic dentistry done, or their general dentistry done for that matter. They ask me questions like, John, how do I find a good dentist? Or how do I find a good cosmetic dentist? And for a while there I thought, well, you know, you just need to look around and see if you like the guy, and answers like that. And it was like, well, how do you do that? So I put some thought to it, and I figured out some things that I think will help you decide how you find that cosmetic dentist. If you are looking for one of the things you can do is ask to see if this guy has some pictures. Does he have pictures of before and afters? And some will come out with just a couple of pictures, some will come out with a book full of them. Now that book full of them is what you want. You want to see before and after, before and after, before and after, until you're just like, wow, man, this guy does this all the time. You see something like that, and you see some really challenging cases made till they really look good, I think you've found somebody that at least you can trust, knows what a good case looks like and how to get from A to B so that you do have a good outcome. And look and see if there's some cases in there that are more challenging than your own. And then if you see, wow, this is really messed up, that's worse than mine, and then the end result is like, wow, that's prettier than mine, then maybe you've got something you can look at, see. Now, one of the things also that you want to do is look around and see if they have a lab. Now, if they have this lab with some ceramics in there, and guys that actually do veneers and actually fix teeth and make crowns and do these kinds of things, that's what you want, okay? You need to have the technician be able to come in and look right at the restoration or right at the veneers, right when they're put in. Good lighting, the dentist is there, we're looking at everything, seeing how the smile line is going, how it all fits. If it needs to be tilted one way or the other, or the center line needs to be moved a little bit, or the length of them needs to be increased or shortened, or whatever it takes to make this thing look just right. If you have that and you have everybody sitting there able to do that right on the spot, the chances of you getting the veneers that you really want are much, much higher. Because otherwise what you're looking at is you have to put the veneers on, everybody stands back and looks at it and goes, you know what, this doesn't look right, it doesn't look too good. What we need to do is, you know, alter it somehow. So everybody is agreeing that it doesn't look right, and so then the dentist has to sit there and write down on a list of paper and list out what all the things are that he wants to have changed, and then take the case all up, box it up, and send it back to the lab and hope that the lab understands what came out on that paper. They will try then to put everything together, and then they'll send it back, and this will be like another week or two later. You get the case, you put it all back on there, and darn, it still doesn't look right. So now what are you going to do? Take it all back off, do the same thing again, send it back, go see, wait and see if it comes back and it looks good, and it comes back and put it back on, and it's still, you know, there's a few other things that could be done. It looks better though, but it's still not quite there. What do? Well, Mrs. Jones by now may be a little bit burned out with this process. The doctor's probably a little bit frustrated too. So everybody's sitting there going, well, you know what, I think it looks good enough. Let's just put that on and say we're done with it. Okay, so you put that on and there's your case. You spent all that time, all that energy, putting something together that turned out kind of like, well, you know what, it went back and forth a whole bunch of times, and everybody just got tired of messing with it, and so then that was the end of the case. You put it together and that was that. That's how you can end up with cosmetic dentistry, okay? Now if you don't want to go there and you don't like that idea, I think you should look for someone that has a lab to make sure that doesn't happen. In fact, when you have a lab, you can actually handle details on the veneers or on the bridge work or crowns that you would normally never mess with, because they're so tiny. You figure, well, nobody's going to really notice that. Well, what the heck, you have a lab, it's only going to take 10 minutes to do it. 10 minutes is nothing. Why not just fix that thing? Why not make it as perfect as you can? Make it as nice as you can. You have the access to all the ceramics to do this. Do it right. Okay, so there's two things you can do that will help you figure out where you want to go. Okay, Make sure that guy's got lots of pictures that you can see before and after, so you can see how he really handles a challenging case. And then make sure he has either a lab tech or a ceramist or somebody around that can help get this case off the ground and looking the way you really want it to look. Okay? I hope that helps.